Good morning, this is Kasturi Day. Today I am going to continue with the circulatory system in Humans chapter according to ICSE syllabus class 8. Okay, so in my last video I told you that there is a SA node. Okay, it's a cluster of cells known as SA node near the opening of the superior vena cava into the right atrium. Okay, from that you can say in that point is the source of the rhythms which the rhythms of the heart, okay, which creates the pumping of the blood, which helps to pump the blood. You know that the heart beats in a rhythm, so that first rhythm starts with that with the initiation of the SA node. Okay, now see from this picture you can see that this picture you can see the SA node starts first the initiation of the rhythm, okay, and from that rhythm due to that rhythm the contraction of the atria or auricles start pushing the blood into the ventricles. Okay, now the ventricles after the SA node has initiated the impulse, it passes on the impulse to the AV node, atrioventricular node, just below the just above the ventricles. Okay, right ventricle, it's just above the right ventricle. There is another node I told you, that is the atrioventricular node. Okay, and that ventricle, that node passes on the impulse to the Purkinje fibers, which are the fibers which are continuing throughout the ventricles, throughout the septum, interventricular septum, and also passing towards the right and the left ventricles at the sides into the muscles of the right and the left ventricles. Okay, so all these impulses these contract the ventricles and pushes the blood into the arteries. Okay, so in this way this pacemaker acts. This SA node, I told you in my last video that SA node is the natural heart's natural pacemaker. It initiates this rhythm, okay, this impulse, okay, and this carries on the heart to contract and then relax. So first the SA node, when it has initiated the impulse, the atria contract and push the blood into the ventricles. Then the atria relax. At that time the ventricles, they are filled up with the blood of the atria, and they when the atria are relaxing, the veins, that is the superior and the inferior vena cava, they pour the blood into the right atrium, and the pulmonary veins, they pour into the left atrium. Okay, they are filled up. Now what happens when the atrioventricular node initiates, that is when the ventricles start contracting, they push the blood into the arteries, that is towards the right ventricle contracting and pushing the blood into the pulmonary artery, and left ventricle contracting and pushing the blood into the aorta. So at that time what happens, the blood is pushed up. Then after that what happens, again the atria contract, pushing the blood into the ventricles. At that time the ventricles are relaxing. So in this way, alternate contraction and relaxation of the atrium and the ventricles takes place. Now, today I am going to discuss, see, when the ventricles are contracting and pushing the blood into the right atrium, into the arteries, the arteries, they feel the pressure, they push, when the blood is pushed into the arteries, they are exerting pressure on the walls of these arteries, arterial walls, okay, by the heart. Now, this force which is being exerted against the arterial walls by the heart is known as the blood pressure. Okay, now the blood pressure varies from one part of the body to another and has two limits, the upper limit and the lower limit. The average pressure which is produced in the ventricles when they contract and pump blood into the arteries, that is, and the aorta and pulmonary artery, that is, these are the arteries. So this is the systolic pressure or the upper limit pressure, which is equal to 120 millimeter of mercury or Hg. Mercury as symbol is Hg, chemical symbol. And the lower limit, what is that? It is the average pressure which is produced when the ventricles get filled up, that is when they are relaxing with the blood from the auricles or atria. Okay, this is the diastolic pressure, which is 80 millimeter of Hg or 80 millimeter of mercury. And this pressure, this 120 millimeter of Hg by 80 millimeter of Hg or systolic by diastolic pressure is measured by sphygmomanometer. See, in this slide you can see the two pictures, which are the picture of the two sphygmomanometer. Okay, the first one, the upper one is the manual one and the lower one is the digital one. Okay, the normal value of the blood pressure of a normal human being, of an adult, is 120 by 80. Okay, but it varies from person to person, affected by age, sex, health of a person. If the health is not well, then it may increase or decrease. Okay, then what is abnormal functioning of the heart? What happens when there is some defect in the structural components of the heart or the blood vessels? The heart shows abnormal functioning. See, first is palpitation, second is cardiac arrest, and third is another one is there, I'll tell you later on. So first is palpitation, this is the abnormal functioning of the heart. Okay, so palpitation, what happens? The movement, it is the movement of the heart when it beats faster than usual. Okay, a person feels as if his heart is beating too fast, as if it is skipping some beats, a beat it is skipped, like that if he feels, or it is fluttering. Okay, even he may notice palpitation in the chest, throat or neck. It is caused generally by anxiety. Then some coronary heart diseases like functioning of the heart walls, malfunctioning of the heart walls or enlarged heart. It can also be due to some effect of medicines or vigorous, if he has done some vigorous physical activity or stress or during some panic attacks, like that. For these, this can happen, and palpitations are accompanied by this are accompanied with the symptoms like shortness of breath, dizziness, chest pain, even fainting. And if these symptoms are there, then the person should immediately be given medical attention, otherwise it can become fatal. Okay, next we come to the cardiac arrest. In the second cardiac arrest is what? It is the condition in which when the heart stops pumping blood throughout the body. Okay, it has stopped, for the heart is stopped for some time, so that is known as cardiac arrest for some time, or it may be forever. Okay, so the common causes of this or common symptoms of this is the loss of consciousness. The person loses consciousness. There is abnormal breathing, then chest pain, nausea, shortness of breath. Okay, then if immediate, in this case, if these symptoms are arising, then the person should, again in this case also, the person should get immediate medical attention, otherwise it can be fatal. Okay, and it is caused due to the narrowing of the blood vessels, especially the coronary arteries, due to the deposition. What happens due to the, in the coronary arteries there is a deposition of cholesterol or calcium, or and calcium also it can be, on and on in the inner walls, which is making the walls narrow, and the blood has to flow in that narrow, that means less amount of blood is flowing through that artery and putting lots of pressure on the walls of the artery, so the pressure is also rising. Okay, so and due to the deposition of the cholesterol and calcium on the inner walls, okay, and so there is a less supply of blood in the heart, and the heart stops breathing. So heart is not getting the blood properly. Okay, and this can be, these causes, these less supply of blood or deposition of cholesterol can be due to obesity, sedentary lifestyle. If a person does not move a lot, or does not do any physical activity, sitting idle, okay, or not doing any exercises at that time, then if he is smoking, if he is a chain smoker, or smoking too much, or consumption of, he consumes a lot of alcohol, okay, these conditions may give rise to this cardiac arrest condition. Okay, so I'll stop here, and one thing I want to tell you, the third condition, the third abnormality of the functioning of the heart is hypertension. Okay, I'll discuss in my next video. Please go through this. If you have any doubt, please do write in the comment box, and don't forget to press the like button if you like the video, so that I can produce you some more interesting videos for you, and that can help you a lot in your studies. Okay, and you can also give suggestions to improve my videos. And also, if you are a new viewer to my channel or not subscribed yet, please do subscribe to get the notification of my next video. Thank you.